Hello, good day, good morning, and good evening, wherever you are. Thank you so much for tuning onto the Kosh TV on YouTube. I'm so happy to have your company today. Um, as I always say, this channel is backed by a group of experts very knowledgeable in their various fields of profession. And the aim is to improve the well-being of the family and the individual as a whole. And we aim to bring you informations that are authentic and helpful to everyone. We will try. We will try. Because, as you know, learning happens every day. So we will try. And I would like to tell you that this phase wouldn't be the only phase you'll be saying. Um, so as we are preparing to give you more information in diverse ways and in various forms, various sectors, as I'm saying, in education, beauty, yes, beauty, um, and some very big um, um, professionals going to give a very detailed information regarding health. I will be holding the fort, and my name is Janet. Today, I'm going to touch a little bit on transfer of the sick to the resource department. Okay, today I'm out of the community, out of public health. We are doing the accident and emergency center. In some other places, they may say the emergency department. So it's the same thing. So you're going to talk about receiving the sick into the resource department. If you work in the emergency department, you do know that we have various units within the department. Okay, various units come together to form the emergency department. We have the triage nurse. That is when you first enter the department. They usually sit in front. Actually, they are those you speak with first. So they will assess you. That is if you came in alone or accompanied by someone, if you are able to bring yourself into A&E and you didn't come by the ambulance. There are some situations which isn't very much. The ambulance crew may have been called. They see you, they assess you, and they think, oh, okay, we should go through the triage process. Yes, we do have those cases as well, but that's very, very minor. It's not huge at all. That brings to mind the accident and emergency center. I don't have my other mic. I hope this is clear enough. Um, the accident and emergency center is actually for very sick people. Okay, if you're so sick, or let's say if it is at night and you're so sick and there's no way you can go to a normal if you're outside the United Kingdom or outside you're not able to see a doctor in the clinic or in the hospital, and you come into the accident and emergency center. Even within the accident and emergency center, we do have a section which deals with minor ailments. So that's the urgent care center. Usually, the plan for this area is to treat those who can be treated, prescribe medication, and advice giving so that you go home. Okay, but in some small instances, again, if the doctor sees you and thinks that no, you should be seen by doctors at the other side, which is made up of more those who need more attention, that will also be done. Okay, so I'll take this opportunity to say that I'll say it again at the end of my my presentation to say that the Accident and Emergency Center is actually for really, really sick. And if it's at odd hours that you actually need a medical attention and you can't speak with any other health professional, then that's a different situation totally together. So there are instances sometimes you see people come into accident and emergency center. You actually wonder if they really needed the treatment, or if because there are people who are really sick and need to be taken care of. So we need to be mindful of those habits, those habits. Yeah, I'll say habits. If you are not very sick and you think you can make an appointment to see your GP in a couple of days, hopefully. Now the government is brought in the electronic assessment for various GP centers. So you go through that, fill in the form, and they would actually advise you if you actually need to see someone face to face, and that is done. If not, sometimes you get a phone call and then they advise you on what to do. Or there is NHS 111 if you are within the United Kingdom. So let's be mindful how we use our accident and emergency centers, okay? Let's be very mindful. Let's allow the healthcare professionals to treat the very sick ones, those who really need the attention. All right. Okay, I am going to talk a little bit on the transfer of the sick within the accident and emergency center. Okay, that's transfer of the sick. Let's say from the rat. That is the rat. Oh, okay. Don't don't come for me on that. But simply put, rat is the anyone who works in accident and emergency knows that that is where the ambulances, okay, bring in patient they pick up from the community. Okay, patients picked up from their homes or on the street due to um, um, one thing or the other. Patient needing attention, medical attention, comes through the rat. Okay, that is a receiving and part of the A&E for people who are withdrawn from the community. So at the rat, you have a nurse. Okay, usually the nurse managed rat is a senior nurse. Okay, Mrs. Is a senior nurse. You should have gone through the process of good assessment. Okay, so I have worked in some hospitals. I mean, worked in some hospitals where the rat is actually manned by a doctor. Yes, manned by a doctor. The doctor receives the patients, okay, the doctor goes through the assessment process with the ambulance crew, take his history and then the patient is transferred to other parts of the A&E, or if the patient needs a specialist care, that is done. So whoever mans the rat desk should be competent in assessment of the sick. Yeah? Okay. So after the patient is seen at the rat center, at the rat section of the accident and emergency, you either stay in the that area to be seen by a doctor and then the nurses, or transferred to either Resus or a specialist care. Let's say you're coming pregnant, and maybe you have passed the first trimester. Protocols may differ from hospital to hospital. Okay, so pardon me, you've passed your first trimester and you have an issue. Okay, it's up to the nurse or the doctor manning the department to actually decide, depending on their clinical skills, that you need a specialist or not. So you may come into RAD and may not stay and would probably be moved to either another specialist area, or depending on the conditions and the state of your condition, be transferred to the resource department. All right. So we do have the resource department, the RAT, the majors, which every hospital I have been to has. So, so the majors, and then there is the minors. All right. So the minors is where possibly you might be discharged home. When you are sent to the minors, you're likely to receive treatment. You can even receive infusions. Blood, no. Infusions, treatments, IV treatment, nebulizers. If you came in with breathing problems, that can be managed, let's say, within 24 hours or within 72 hours, because some we have situations where patients actually stay there overnight. And I do know that under normal circumstances, this isn't supposed to be the case, but due to shortage of beds, okay, for everyone that comes into the department, sometimes patients tend to spend more hours in the minors department than necessary. But treatment is given, you are seen by the doctor, and if the doctor feels you need to stay there for a few more hours or be transferred to another part of the hospital or A&E, that is done. Okay, so from the minors we go to the majors. Majors, in most circumstances, patients are admitted. Okay, the patient can spend more than 48, 72 hours, depending on the bed state of the hospital. All right. So, and depending on your condition as well, all these is factored into your stay into hospital. So, in majors, you receive treatment. Majors, there is a bed. You're supposed to be in bed because a decision has been made that you will be admitted. Okay, so there you receive all your treatment that is necessary, whatever you may think of. You have nurses looking after you. You're receiving your doctors. Doctors are also coming and they are checking your progress. So in majors, you are either admitted, or if the treatments given to you has made an improvement, you can be discharged home. Now, for today, we are going to center our attention on receiving patient into resource department. So the resource department is where very sick patients are taken to, and that is within the accident and emergency center. Okay, it's the setting is a bit more like if you've ever been to the intensive care unit. Yes, that's the setting. With a few equipment that may be missing, but it depends on the hospital as well. So that is the resource department. And patients received into the resource department could either be brought in by the ambulance crew or maybe from within the accident and emergency center. Okay, so if the ambulance crew is called and come to your home, or you are found on the street with a stab wound or whatever it may be, and your situation is so critical, and the ambulance crew will also do the assessment. This is where we talk about the levels of patient depending on how sick you are. There are levels to it. It could be level 1, level 2, level 3. So when they assess you and they think you need to be in resource department, they contact that hospital they intend to go to, department, the resource department. There is a phone, a special phone designated for this purpose. Okay, so that phone, that number is known to, or it's known to the ambulance crew. So they will call in the resource department depending on where the phone is, because sometimes it may not be in Resus, it could be in Majors. It's centered in a place where the experienced nurse or whoever is coordinating the unit can have access to. Okay, depending on how the hospital feels, the hospital has planned its treatment pathway. Okay, so they call that very number and then tell you what they've got coming. They will tell you what the patient's condition are. So it's usually the ABCD. Okay, ABCDE. So the patient's condition, what they've found, and then they will give you the past medical history. So there's the S bar comes in here. Okay, the S bar, that's the situation, the background, your assessment, and then recommendation. It's kind of plays around this area as well. So they tell you what the patient is coming in with, or the state of the patient, past medical history if they have access to it, and the observation, that's the assessment, like the blood pressure, respiratory, the SARS, the ABCD also comes in. So sometimes when they tell you this, you, the nurse, at the phone, you've taken this. If it's an experienced nurse, you are able to decide whether the patient come to you in Resus or the patient should go through the RAT system pathway. Okay? Yeah. It may sound a bit complex to, if you haven't actually been in a hospital setting and haven't actually been in the accident and emergency center. It may sound a bit complex, but I hope I'm doing a good job by explaining the process. Okay, so at the resource department, the resource unit, actually, I think to me it's one of the best places to work because you have the access to a doctor when you need them. Okay, you have access to the doctor when you need them, and the doctors when you need them, and you have other team members. Yeah, because I've spent a few, and I intend to inside the department. Let's see how things go. So in that department, so when the patient is coming to you, nurses in the department would have been informed that we are expecting such a patient. Okay, and they tell you the history. So sometimes people will decide that if the in charge doesn't say you take it, people will say, "Well, I'll take that," depending on how confident you are of the patient coming to you. Sometimes the in charge will always say, "No, I want you to take this." Okay, it means the in charge knows that you are able to deal with the situation coming, and the doctor on duty is informed. Okay, if the patient will need a cardiologist, in in some instances, they may have been informed, or let's say a patient is coming in with stroke, they may have been informed that, okay, this patient is coming in, so that they also prepare. So the stroke team will also prepare. So you see how it works. So you kind of have all the doctors if you're lucky, and in most circumstances, there are situations that it's kind of a bit dicey to get a doctor. So in circumstances like this, so if that's me, maybe I have been lucky, but in the resource department, you do have doctors if you need them, and uh, teamwork. That's what I'm used to, teamwork within the resource department. So if this patient comes in and the other nurses, um, uh, patients are settled and are doing well, observations, like they don't really need to be attending to at that moment, everything is settled, okay? Or there is any other nurse who is free. If this patient comes in, at least the named nurse, the patient, the nurse receiving this patient, and the nurse who is kind of free, okay? The doctor, let's take it that the doctor has also been informed, the doctor is around. You settle this patient in the cubicle, because circumstances like this, time is of the essence, because the patient is seem to be really sick, and you have to race against the clock in some situations. Okay, so my dear fellow colleagues, when a patient is received in the resource center and you are free, assist the named nurse. Assist them. Help settle the patient. This is what goes into it. The patient is settled in the cubicle. Obviously, the patient will be assessed. Blood will be taken. So as one is assessing the patient, trying to connect the monitors and all that, the car's monitor, one is quickly taking blood. A patient cannot come through A&E, especially the resource department, and not have an ECG. It's one of the initial observations that must be done. Every sick patient needs an ECG. The nurses know what I mean by a sick patient. So even if a patient is in your care, all right, on normal ward, and the patient takes a turn for the worse, ECG forms part of your observations. Unless you think it's not necessary, or your charge nurse or doctor tells you it's not necessary. But every sick patient needs an ECG. So if a patient comes to you in Resus, no matter what, do an ECG. Do a heart tracing. Okay? So because the patient will be put on a monitor anyway. So if the patient is put on the monitor, you just do a tracing and then you print it off. And then your observations are also done. You will be surprised to those department or hospitals that are not trying this. Try it. A patient comes to you sick. Two nurses quickly settle this patient. You take blood, whoever is supposed to be taking blood and all that, coaches, whatever. And then the doctor also comes in, and you present it to the doctor, or the doctor is with you, and these assessments are done. Can you just imagine how the plan will be like? Okay, so immediately the doctor has access to all the information he needs or she needs, and then the um, um, diagnosis process begins, and then treatment is implemented. The French will say, voila, then you begin a prompt treatment. I have had a situation when it looks like when the patient comes, it's yours. No, no, it's my patient. Yes, but you were free. Just help settle the patient. If you wouldn't do anything at all, just connect the wires, whatever there is a lot. If you work in A&E and you've been in Resus, there is a lot that has to be connected. Like the patient may need oxygen, you would have to put in those monitors. If the patient came in with breathing difficulties, you can just imagine what that really means. The doctor is probably struggling to take an ABG, and blood has to be taken and all that. Can you just imagine that? This is just an instant. So a patient comes to Resus. Anyone who is less busy, assess the name nurse to settle the patient. This is all part of teamwork. Settle the patient. Make sure the treatment, even if you wouldn't assist with the giving of medication, IVs and fluids, just connect the monitors, and then print up the ECG. Okay. Make sure the blood pressure cuff is on and the patient is all connected to the machine, and then just let the name nurse and then the doctor continue with the assessment.